Thank you very much. Not the best slot, keeping you here. I'm the only thing here between you and food, so I hope it will be interesting. So today we are talking about protecting our elders. We had a nice kind of chronological session this afternoon, from mothers carrying unborn babies to babies, etc. So throughout our adulthood and coming to aged. And again, the fact is that we are all aging. So my disclosures, I really have no potential or perceived conflict of interest. I have to admit my bias. I like probiotics, I like bugs. Again, I do have a relationship with the AEP, which is Alliance for Education in Probiotics, and I work at the Family Health team. One of the things I also like to use in my presentation for healthcare professionals, especially for primary care healthcare professionals, is to use brand names. And it's not because I have preference towards one or the other product, it's because it's much easier to remember if we use brand name rather than proper designation of a strain. A strain includes genus, species, and specific series of numbers and letters, and quite often is difficult to remember all those. In Canada, we have a unique situation that one strain usually has only one or maybe two products carrying that specific strain. So really, it's just to have it as easy learning experience, not because I have any preference toward formulation. So today, at this last session, we are talking about changes, and we've mentioned that throughout the whole afternoon, that things change, especially early in life, throughout adulthood, but then as we age, things change with our microbial composition in the gut. And again, there is a dynamic interaction between nutrients, medications, chronic diseases, and gut microbiota. We have established that already, but we'll take a closer look at elderly. And again, can we influence somehow that microbiota balance at that stage of our life and then improve quality of life in aged? So basically, one of the facts of life that we are all aging, regardless whether I color my hair or not, I am aging, and we all are. And these are some of the statistics, kind of Canadian statistics based on Stats Canada. And look at the numbers. It's kind of staggering that, how many of our patients, and us as well, will be, at some point over 65. And more people are actually living longer and longer. And this is something that is, presenting kind of very huge challenge, not only for us as healthcare professionals, but kind of for society in general. One of the things that we have established already is the fact that microbiota changes as we go through different stages. Again, looking at, we mentioned pregnancy, and this is, I guess, I would say, corrected. We know that throughout the pregnancy, babies' gastrointestinal tract is not sterile. We are learning that now. Birth does affect how quickly babies will pick up bacteria. We already talked about that. Through infancy, we change very quickly and very dramatically. And then we get to adulthood, that kind of as we age, we start changing our diversity for worse in a microbial balance. And as we kind of get to age 65 or more, again, it's very different for different people, we are getting more of the kind of losing diversity and having more of the bad bacteria and less of the good bacteria in the gut. How this translates for overall health? I believe we have established this already, so I'm not going to talk too much about it, is that really microbiota does have effect on overall health. There are different mechanisms how it works, and as I say, I'm not going to go through too many details. Just we mentioned there is a direct effect with the gut-brain axis on our mood, anxiety, depression, etc. There is direct effect on metabolism, not only through liver but through kidneys as well, with actually helping digest and break down certain nutrients and taking the pressure off the liver and kidney if the bacteria is in proper balance in the gut. Defense against pathogen is already established, and again, alteration in intestinal function will affect our motility, visceral sensitivity, barrier function, etc. So this is all established. So imagine if, as we age, things start changing. So it's not only that we'll change the balance of the gut microbiota as we age, we'll have effect on the rest of the body. Kind of funny, not very funny diagram. And again, thinking about this here, I mentioned in this diagram, changes in diet, motility disorder, calcium secretion goes down, which can lead to dysbiosis. There is changes in the enteric nervous system. But also think about something else that most of our older patients are doing. They are taking multiple medications. So just think about that last time you saw somebody over 65. Are they on PPI, proton pump inhibitor? Most of them are. And most of them have started that 8, 10, 15 years ago because of the acute event, and they don't know why they're still taking it. They often forget it, and they are fine, but they take it because they like to listen to a doctor. You just keep taking your medications. So it's something that, right now in Canada, for example, we have a huge movement of deprescribing. It's something that we are looking at medications, especially chronic medications in patients, and reassessing whether it's needed. And PPI is on top of the list of drugs that we are now asking patients and asking them if we can taper it down, stop it, and go back on it if needed, or do something different that might be safer for their overall health. For those that are not pharmacists or working with the offices, PPI is a proton pump inhibitor. It's a whole class of medications like Losec, Pantolog, Periet, etc., Nexium that people are taking. So then looking at other things, these patients also might be on chronic antibiotic prescriptions. How many of your patients are on daily sulfa to prevent urinary tract infection? How many patients do get, just repeated prescriptions for antibiotics for upper respiratory tract infections? So this is already a population that can suffer through much more dramatic and drastic side effects of this medication. But again, think about it, their microbiota is already been changing as we age. So again, the changes in changes in this dysbiosis, changes permeability of the lining of the gut. We already established that it will affect immune and lead to immune dysregulation, changing the metabolism of the host, increasing insulin resistance, leading to chronic inflammation. So sometimes we kind of wonder whether it's inflammation that is causing this or the changes in microbiota causing this. But again, what is older, chicken or egg? We don't know. But again, it can lead to more severe chronic issues. So as we age, composition and activity of the gut microbiota changes. We have increased infection rates, we have increased inflammatory disease, inflammatory processes in patients. And again, there is also modulation of diet and nutrition. These patients maybe cannot digest things anymore, they don't feel like eating, there are changes in appetite, they don't have motivation to cook for themselves, etc. Maybe there is some issue with chewing or swallowing food as well that can affect what they eat and how much they eat. Many of those patients will have either chronic diarrhea or chronic constipation, etc. How many of your patients are on Soflax, Docusate, stool softener that again, we know it doesn't really help, and this is another one on the list to deprescribe. So again, as I mentioned earlier, when we think about it, we don't have a consensus if the aging is affecting gut function or gut function and dysbiosis accelerating aging. So kind of what is older? And we do know that gut immune response and microbiota composition are impaired in an elderly, and again, there is changes in diversity. There are some more data to show you that as the younger subjects have different composition of microbiota than elderly subjects. There's even looking at specific species living in a gut with the young patients versus patients that are very old. Big changes, and again, changes in good bacteria producing good short-chain fatty acids and preferring the bad fermentation happening in the gut. So there's also some terms that you may have heard, inflammaging is something that basically talking about this low-grade inflammatory state in elderly that is kind of related to age-related chronic conditions. There is also something that describes physiologic declines in immune function in elderly as well that can lead to impaired cellular and adaptive immunity in patients as well. So all of that is linked to the microbial dysbiosis in elderly. So question is that we like to kind of address here, can we change this? Can we improve it? Can we alter it in a way? And again, there are clinical trials that show health benefits of probiotics, and I believe we mentioned a few today as well, that can be achieved through affecting the composition of the microbiota in elderly population, and also affecting and improving some of the symptoms of major gastrointestinal diseases. Most of the probiotics that have been tested are from the bifidobacteria or lactobacilli genera, and again, studies specifically in elderly populations. So we'll kind of go through a few of them and see what is the evidence. Again, we picked up some of the specific studies. This is not all. There's more and more studies coming out every year. So this is one study that was done with bifidobacteria, and they said that good evidence that probiotics can increase abundance of the good bacteria in elderly subjects, and we can maybe modulate microbiota by probiotic administration. Then there is another study looking at specific Bifidobacteria subtilis, CU1, that can increase some of the inflammatory parameters in elderly. And again, post hoc analysis showed that decreased frequency of respiratory infections in a probiotic group as well. So then, what do we tell our patients? When your patients walk into the pharmacy or grocery store, this is what they see. It's confusing. These are photos taken in some of the pharmacies in Hamilton. I just went in and took pictures. For example, this particular one here has, oops, my fiber is all over the place. And good thing this was not the sample for the FMT. So, going back to the probiotics, this is what your patient will see on a shelf. It will be omega-3, potassium, probiotic, wild salmon oil. So it's good in good alphabetical order, but we don't really know what kind of probiotic, what is in it, etc. Or more confusing, they will see something that says probiotic. It says actually, I think, 2 billion. This is complete probiotic with 5 billion. There's probiotic 10 billion, probiotic 30 billion. Very confusing. Would you know what to take, what to recommend? No, not really. Again, in a grocery store as well, there is so many different things that people can choose from, and then, flashy labels, etc. So what do we recommend, and what do we tell patients to take? It is very, very challenging. So then let's look at some of the specific studies, that maybe are looking at products available in Canada. So let's review them. So this is basically my questions for you were, how often do you recommend probiotics? Anybody? Every day. So how often do you recommend probiotic for specific condition or prevention of some condition? And how often do you recommend very specific probiotic, very strain-specific product for desired outcome? Sometimes. So that's the challenge. So basically, looking at products available in Canada, because we live here, this is our market, so let's see what we studied. So this is an example of a large study in elderly patients 60 or older, and looking at the effect of 3-week intervention with fermented milk containing probiotic. And it showed incidence of winter infections was not different, but duration and pathologies, the symptoms of it, significantly lower in the intervention group when compared to a control or placebo group. So this is, again, Canadian product. Then, looking at next study, looking at this probiotic drink, and reducing incidence of the antibiotic-associated diarrhea, and this was done with the patients 50 and over. Really decreased the morbidity, healthcare cost, mortality if used with antibiotics. Also, there is a clinical trials. There are some products, again, this is a combination product, comes in a yogurt form and in a capsule form, that reduce the antibiotic-associated diarrhea, and in some cases even C. difficile diarrhea in elderly patients. 72 years was the mean age of these patients. So those are kind of very interesting products. Then there was a review that compared few different, look at the studies with a few different products, Bifidobacterium lactis, then Lactobacillus casei shirota, which is not available in Canada, and E. coli Nestle 1917 is available in Canada as well. So those are, again, looking at few different and compare a few different products or strains and looking at improvement in a frequency, defecation, stool consistency, and they're also looking at pH in the colon, looking at production of the short-chain fatty acids that we mentioned before, and again, changes in transit time in these patients. So there is evidence looking at specific strains that are commercially available in Canada. So, you know, kind of when looking at this, probiotics have particular application in elderly population. Research is still going on. We're looking specifically in terms of protection against infections, minimizing some of the age-related diseases. As I mentioned, some of those patients are frequently on antibiotics and they are at high risk of developing adverse reaction to antibiotics, not finishing it properly, etc. That can also impact the antibiotic resistance, etc. So really, it's kind of a problem that can be not only with one patient, but many patients in the population. And again, we are needing more studies with this specific population. So this is, again, I mentioned some of those strains, and I promised to you that I'm going to give you brand names. So again, this is, and I'll tell you why I have these smileys later. So these are some of the examples of probiotic products for specific indications. So this is, again, example, instead of saying this Bifidobacterium animalis, lactis, and all these series, I might say Activia. Or I might say, instead of Bifidobacterium longum infantis and these numbers, I can say Align, etc. So these are some of the strains and products. And again, the evidence for the antibiotic-associated diarrhea, for example, constipation, common infectious disease like common cold, IBS, etc. So the reason why I have smiley faces here, not the proper level of evidence, is because I work on translating the science, looking at the evidence, and telling and helping actually primary care practitioners select product with corresponding indications based on clinical studies, based on many other aspects of the study. So this is what, you know, you mentioned, you probably, some of you did see this guide. We developed a guide and we classify level of evidence as 1, 2, and 3. We believed number 1 is the highest, 2 is kind of okay, and 3 is the lowest level of evidence, but some evidence. This is kind of oversimplified level of evidence, and we've had some requests to express level of evidence as a grade model, and we did that. And we ran some of the focus groups with the primary care practitioners in Hamilton area, in Toronto area. And guess what the feedback was? They told us, we hate it. If you put grade level of evidence, we cannot use it in a clinic. We don't have time to do that. Put the smiley faces on. This is why I have smiley faces on. This is based on my feedback from my focus groups with primary care practitioners. So again, it is basically, I would say, maybe oversimplified, but this is why you have this clinical guide that has been in kind of updated yearly for last 7 years. And we try to reflect products that are commercially available in Canada. We list proper strain for each product. And then we look at studies done with this particular strain and what is the indication based on an outcome that was designed for that study. This is my idea, but it's not my work. I have a great advisory board behind me. I have GIs, I have people that are looking at the evidence, the academics, I have primary care practitioners, etc. So this is a great group of specialists and very smart people that actually tell me if I'm doing something right or wrong. And we have to reach consensus to publish and change and update this guide. It's not the best, it's not ideal, it's work in progress, and we are open to any suggestions, comments, anything that you have to say. And again, it is printed in a booklet. We have limited amounts of that because we have really no budget. And then we have also a website and apps you can download on your phones and use it to look for the product for a specific indication, or if you are wondering what this product is, try to enter the name and see what has been studied for. It has all the references as well as online and in print as well. So basically, composition of gut microbiota changes as we age, that's a fact. Microbial composition has effect on overall health and quality of life. That's also established. And again, bacteria or probiotics, appropriate diet or prebiotics, as Sandra mentioned, can play an essential role in maintaining the healthy microbiota as we age. Something really to think about. And again, I do think that dietitians play a huge role. You know, when people start rolling their eyes when you say you should eat more fiber, you might need to take another few minutes, explain to them why and what that actually translates for the health of the bacteria in their gut and what bacteria in the gut can do for their health overall. So I try to get my talk a little bit shorter than I was supposed to, so we have some time for questions, and I'm not keeping you too long, so I'm not keeping you away from food. Thank you.
Thank you. Thank you, Dragana. So one question, time for one question, okay. I think.
I just was wondering if you could comment on the use of probiotics for UTI prevention.
Sorry, for?
Urinary tract infection prevention?
So there's lots of research looking into that. Mm-hmm. There is a combination of 2 strains that is available in Canada in a capsule form. With the good evidence for bacterial vaginosis and vaginal yeast infection. They also looked at that strain and compared it to sulfa for Bactrim daily to prevent UTI. And some studies were actually done in elderly patients in nursing homes. So preliminary evidence shown very promising effect. So again, at this point, we don't have enough evidence to include it here. We're looking for more data, but there is definitely lots of research going on into that area.
Thank you.
Thank you. Well, thank you very much, Dragana.